I think it's my experience with Dato-DXd has really been that on paper these side effects are frightening, but they're not brand new to oncologists, right? We've dealt with the fatigue, with the mucositis and stomatitis.
Yes.
The ocular toxicity is always a little bit frightening because it lands outside of our realm and we need some help sometimes. But I've also found that with this drug that a lot of it is dry eye that is manageable. But I think being proactive about toxicity management is really important here. So for our colleagues who may be listening to this conversation and haven't used the drug, what are your best practices for ways you tell patients to deal with these side effects, particularly the dry eye and the mucositis?
You go ahead. Okay. So yeah, we definitely educate them. We say, these side effects can be frightening. You may feel like, oh, this is something very serious, but usually they're not serious. They're reversible. They're manageable. We definitely want to know about it as soon as possible. And we like to have you connect with, our eye clinic. So we always have that set up, especially working at a big academic center. We have a great resource available. But even in the community setting, there are going to be some ophthalmologists or even optometrists who could help. So I think just educating patient, making sure that they're not, afraid of those side effects, that they're usually mild, reversible, manageable. So, that kind of thing.
Yeah, absolutely.
And mucositis, as you know, and as you said, we've been using many drugs that cause mucositis, and we educate them. We use the steroid mouthwash, things like that. And that has never been a huge problem.
That's great. Great to hear. Yeah.
And so at the University of Kansas, I'm at one of the community sites. And so I'm very fortunate to partner with ophthalmologists that have an active interest, but not all of my patients are willing to drive downtown and be seen by them. And so recognizing the challenges in the community, maybe finding that ophthalmologist that you can make a connection with that can then become well-versed in this, because one of the things is doing an ocular exam prior to the initiation of this and trying to have that collaboration so you can get someone in and not waiting for that next fail, recognizing this is what's going to could be a barrier to starting treatment, getting that connection, getting them in quickly. But yeah, eye drops and stomatitis are the two things that to watch out for definitely for this. But just like with pembrolizumab and learning about steroids, and with trastuzumab deruxtecan and learning about pneumonitis, this is just something else that we're going to have to be good at. And we feel comfortable as we get more experience with that, then it becomes a lot less confusing and scary.
Yeah, absolutely. I think one of the things we've done to be proactive about it is we've incorporated the eye drops that patients can proactively and preventatively use, lubricating eye drops, as well as the steroid mouth rinse that you brought up, Praveen, into our chemo plans, so that when we place the orders for an IV treatment, we're automatically releasing those oral or home use medications in the terms of the eye drops to a patient's pharmacy, so that they just have them and it becomes more automatic.